Today, we're going to talk about poop. I'm Abby.
I'm Charlotte.
And I'm Shreya. Today we're going to talk about C. diff infections and an up-and-coming treatment, the fecal transplant. To start, we're going to have to give you some background. What is C. diff? Clostridioides difficile, or C. diff, is a highly contagious bacteria responsible for severe gastrointestinal damage. C. diff is an anaerobic spore-forming pathogen. The pathogen mainly attacks the intestines by releasing toxins that destroy the lining of the intestine. This forms a plaque of inflamed and dead cells, which is responsible for the severe diarrhea.
The main way to treat C. diff is through rounds of antibiotics. In order to be eligible for a fecal transplant, the patient must fail multiple rounds of antibiotics. Only then can their team of doctors elect to perform a fecal microbiota transplant. All fecal donors go through a vetting process, then donations go through rounds of testing. The donation will then pass through a colonoscopy scope and into the colon of the recipient to help replenish the beneficial bacteria colonies in the gut. C. diff symptoms are caused by an overabundance of C. diff toxins. When the gut does not contain enough good bacteria to keep the C. diff colonies low, the colonies become the dominant bacterium and start breaking down the intestine. A fecal transplant can help to reintroduce the healthy bacteria back into the intestinal tract to return the bacteria to a healthy population and lower the amount of toxins in the gut.
So what are the risks associated with fecal transplant? There are risks with any medical procedure. The introduction of bacteria can create severe side effects of diarrhea, cramps, and fever, along with the positive benefits. Feces contain hundreds of bacterial species, many of which are unknown and could be very dangerous. There were at least 6 patients who developed infections from an antibiotic-resistant strain of E. coli following fecal transplants, which led to the FDA issuing a warning for new safety measures. Fecal transplant is currently only limited to patients with recurrent C. diff who have failed multiple rounds of antibiotics because of the high risks of infection during the transplant process.
It is important we spread awareness about this disease. C. diff doesn't usually affect healthy young adults because they contain normal amounts of stomach acid to kill the bacteria, but young children, old adults, and immunocompromised people are at greater risk of contracting this disease. Around 500,000 people worldwide have C. diff infections, which is almost the entire population of Atlanta. Furthermore, the methods we use to treat C. diff can help develop future treatments for other gastrointestinal diseases, like irritable bowel disease and colon cancer. You can also help out C. diff patients by becoming a fecal donor at openbiome.org.